I'm not too worried about dying myself for some reason. I'm just worried that I left the people behind me. So the 1 and 2 year just wrapped around, what can I do now for these people? I don't know why. It just never dawned on me. It's not scary for me to die, but it's scary to leave people behind.
As the patient, Cathy's responsibility is to get better. As the caregiver, your responsibility is to do everything else. She doesn't have to do anything else except get better. We're responsible for making her feel comfortable, whether that's rearranging her bedding, helping her with the clothes, getting her food. Everything else is up to me and the caregiver.
I'm originally from Shanghai and came here in 1990. Now married, was a 19-year-old son and a 32-year-old stepdaughter. She lives in LA. Work-wise, I worked in insurance for the last 19 years. Actually, we both did. He did a lot longer. Before the diagnosis, I was a product manager for an insurance company and just work on the IT side, making sure my business has a robust and stable system.
Well, we were actually both employed by the same insurance company. And the first time I saw her, I'm thinking I kind of sized her up as being a very quiet, introverted, typical Asian lady, which she was. And then eventually it turned out, once you got to know her, that she'd become a very assertive, intelligent person that has a mind of her own.
Probably around late April, I actually had quite an episode of vertigo. Never happened to me before. I was driving home, probably 10 minutes away from home. All of a sudden, I felt this sound of blood traveling from left ear to the brain. So it's almost like I can hear it. And then my vision become blurry. And I thought, okay, maybe it's my contact lenses getting dry. I keep driving for a couple blocks and the road just start to kind of start moving. That's when I get a little scary. I parked on the side of the street, and that's when I closed my eyes. I couldn't open the eyes. I called my husband to pick me up. We went to the yard. They couldn't find anything, and I had about a similar mini episode about 10 times for the next 2 or 3 weeks.
Oh, wow.
I know, yes, I know it's coming. That noise comes, then the head spins. If I keep my eyes closed, I'm okay. And later on, I read maybe it has something to do with low platelet, but I don't hear too many people mention it.
Yeah.
So this was I didn't make the connection until way later on. Then there was, no, I'm still running, I'm still doing my weights, but after work, I work Eastern hour, 4 o'clock, I get off. I get really sleepy. I don't usually take nap in the afternoon. So those used to be my workstation. I would right away take a nap on my sofa for like an hour and then have him wake me up so I don't sleep through my dinner. And that's kind of something new in the last month or two before the diagnosis. My husband retired last May. On the retirement day, May 27, I said, let's go get a blood test. So because he doesn't like to know about those numbers. Turned out his numbers came back all normal. And mine, pretty much all normal, except for platelet was in the 50s. And I didn't really understand, I know it's lower than the lower bound. Okay, just low.
My personality is not to be the knee-jerk, oh my gosh type of reaction. It's like, okay, so we've got something here that's not very normal. Let's just see where this goes first. So to me, I had a little bit of time to process this stuff.
I don't feel like I have cancer, right? I feel, other than I have quite a bit of strange bruising on me, which is normal because I'm clumsy. But those are in areas that I don't usually hit myself with, like sometimes in the back of my finger. I still feel normal. I just, on one hand was like, okay, maybe the numbers are pointing to that direction. On the other hand, I just don't want to believe it. Maybe something is wrong,
For the next day or two, I was thinking like, well, it could be absolutely nothing, or it could be something a little bit more serious. But as time rolled on and we did more and more tests, it became very obvious that this wasn't something that was just going to be simple. It was something that was serious.
And a couple of days later, my PCP from Kaiser emailed me, said, I want you to get a spleen ultrasound. And I was like, why? What's the relationship, right? So I did, and it's 18 centimeter. So then that's when I start Googling, okay, 18 centimeter is 50% larger. So there must be something wrong with me. I'm the type of person who likes to know every details, and I felt I wasn't fed every detail. So from the teardrop shape red blood cell, I already kind of also know it points me in the same direction as well. So pretty much from June to July, July was when I was given the official diagnosis. I'm already thinking, I think this is it, but I'm not sure, kind of back and forth.
How deep did you get? You saw blood disorder, or maybe did you see cancer? Did you see myelofibrosis? Like, how detailed did you get in your research?
I saw myelofibrosis, primary myelofibrosis, as one potential diagnosis. 3 days after my blood test, I just went back and looked at all the history of the emails. She asked me to do the spleen ultrasound. A couple more days later, teardrop red blood cell. She said, read this. They're leaning towards. They are in the paragraph. They already said we're kind of leaning towards MPN, and I had no idea what MPN is. A couple days more came back. You have teardrop shaped red blood cell. And what does that mean? Now you need to get a bone marrow biopsy. I Googled YouTube video, seeing the big needle with the big handle drilling in, and I tried really hard to not do it. Do I really need to? Is there another treatment option? And she said, that's pretty much the gold standard. Gold standard for what, right? So I did in San Leandro. It's more about me being nervous than the procedure itself. It wasn't as bad as I thought. They did have a little trouble getting the marrow out. Later, I found out it was actually a symptom because I'm kind of dry. So the fibrosis level was, I think, 74 from the biopsy. So the next thing coming in the pipeline is I was referred to a hematologist. But I think he had a hunch, and my husband was listening to the call as well. I can tell he was trying to be very conservative. He asked me about symptoms, and just trying to gather all the information other than the blood test, and then tried to hint to me, do you have a sibling? He asked me that. Yeah, that was another clue for me. I just need a few blood tests to, he didn't get into the detail, whether it's a mutation, chromosome. I did ask him, am I going to get a chromosome test? He said yes. I was given advice as soon as I met my doctor, said, don't Google. I'll say the opposite with a grain of salt, because how would I be able to ask these questions or know what's missing without knowing what tests are pertain to my disease? But of course, you have to look at reputable sites. It's like I go to Mayo Clinic. I look at, what is it? A lot of the blood, ASH.
Yes, ASH.
Yeah. Yes, they're hard to understand. I look at the article like they're as if they're foreign language. I Google pretty much word by word what they are and put it together to understand. I figure it's a disease. Someone has to be able to understand it. No matter how complex, it boils down to, something is wrong with you that's causing this, and therefore there's a potential solution.
How long did it take to then finally get a diagnosis from the time you met your hematologist?
A month.
Another month.
Yeah, it's the longest month.
Talk to me about
that. During work, I was busy enough to not think about it. But as soon as work is over, my brain just gratitude towards, Could it be cancer? Could it be something else? Just kind of back and forth, what's going to happen. I already look at the life expectancy and that, but I don't know how severe I was. I did not find out about the scoring system, so I don't know how to score myself yet. What's going to happen? My son is 19. If I'm not here, he's going to? Financially, he will be okay. I planned this from when he was very young, but what if he needs guidance for career, for a girlfriend, for life? Who's going to take care of my husband? He is a lot older than me when he, needs medical care. How about my parents? So back and forth, until my brain got really tired. And eventually it says, I don't want to think about it anymore. And that eventually, I can't wait until my call was for the diagnosis, which is on July 8th. I remember when we had the call. Now I'm thinking back, would it be better if it's in person or video? I've seen those in movies before, right? You walk into a doctor's office. This was just a phone call. And as soon as we get on the call, I can sense he was nervous. He wanted to be careful how to break the news to me. So I told him, I said, I've already done my homework. I think this is what I have. So I gave him my suspicion. And if that's the case, go ahead and tell me. I'd much rather know about it and get it over with. But he was still being very careful. He explained the scoring system and how he ended up, he was looking at my platelet, spleen size, fibrosis, and then also mutation-wise, I'm okay, but there's one other thing, sorry, I can't remember. Karyotype, yeah. So those all add up, and then JAK2 was my mutation type. It was a deletion of one of the 44. So that's the part I don't remember, but in the scoring system, it will tell you these are the bad ones. So I fit into one of those. As soon as we get off the call, I was Googling MIPSS 7.0, and now it makes sense. But at the time, I didn't know about it. All I know is I'm probably MF3. But what does that mean? I didn't know. I wasn't sure where that scoring system came from. I thought I'd done enough research for the whole month. At first, I didn't believe in the scoring system, but then when I started looking into it, I realized, they make sense and they're very objective. It's either you have a low platelet below a certain number or not, or you have this mutation or not. So it's kind of black and white. But before this, I couldn't tell. To me, cancer could be, we've seen lung cancer patient or, liver cancer. It's not that black and white, but afterwards, it's more clear. It's just, I wasn't prepared to have such, this number thrown at me. I would recommend you looking into transplant, sibling donors. I said, oh, that's why you asked me about sibling last time. You may not need it right away, but it's better to consider it when you're still relatively healthy. I'm kind of a dinosaur when it comes to this kind of thing, but eventually it kicks in. And I'm not too worried about dying myself for some reason. I'm just worried that I left the people behind me. So the 1 and 2 year just wrapped around, what can I do now for these people? I don't know why. It just never dawned on me. It's not scary for me to die, but it's scary to leave people behind. My husband doesn't talk much when it comes to this. I know he was trying to be very calm for me. He always say, maybe there's a treatment out there. Maybe, there's hope. He's always trying to feed me hopes, but I know he is the kind of person like to keep things to himself. And I like to get it out of him so he doesn't, get. So that's kind of our conversation. Like I would talk about my concerns and he doesn't talk much.
I couldn't fathom it. I couldn't fathom losing my wife. She's a lot younger than I am, and it was just racing through my head that this isn't fair. You know, I should be the one that should go first. And I was just so afraid that I'd lose her. That was the hardest thing for me to process that. But once I got over that, I realized that we're not throwing in the towel. Not now. Not when we still have options. I thought that she was a strong lady. She was going to deal with it. And I thought that the best thing that I can do, because we are a team, we're going to see this together, see this thing together, see this thing through together, that I'm going to be there every step of the way. I'm going to give her encouragement, and we're going to fight this thing together. And I had a pretty good feeling that we were going to beat this. And I say we because it is her and me. As a caregiver, maybe you're not doing the actual fighting, but my goodness, you're doing all of the support. As the patient, Cathy's responsibility is to get better. As the caregiver, your responsibility is to do everything else. She doesn't have to do anything else except get better. You know, we're responsible for making her feel comfortable, whether that's rearranging her bedding, helping her with the clothes, getting her food. Everything else is up to me and the caregiver.
My son, being a teenager, he doesn't talk much, but he occasionally would ask me or even ask his stepsister, what's going to happen to my mom? How many years can she live? Is it going to get bad very soon? You can tell he's thinking about it, but he's probably not comfortable just coming up to me and talk. But I did want him to know right away because I think he's old enough, you know, he's part of the family. I don't want to kind of hide this away from him. I was able to get a second opinion within Kaiser with a different hematologist. He take his time and he looked through my numbers and he concurred with the diagnosis. I also tried to reach out to hospitals outside Kaiser, some major cancer centers. I reached out to like 4 of them. 1 of them responded. Going back to, I know in our Facebook group, we always talk about MPM specialist. In my experience turned out it's actually not that easy to get hold of one. I even asked my Kaiser hematologist, so are you an MPN specialist? I know his name is not on the list. Now that I think back, his diagnosis was accurate. He said, well, we handle 1 myelofibrosis patient, 1 each month, but I don't know how to interpret that. Now I'm looking back, it's probably a pretty significant number because Stanford handles about 25 myelofibrosis transplant a year. Going back to out of the 4 major hospitals, 1 of them got back to me. I can talk to a hematologist, but not an MPM specialist, and totally out of pocket, about $5,000. When your level is high, even after you've gone through a transplant, the fibrosis level is not going to decrease right away because the new cell takes time to grow, to attack. So it might take a month before your fibrosis levels go down, which means your blood count may not go up as fast as other disease. So just kind of be prepared. I talked to a lot of patients that, you know, my blood count is still this, but now I'm like day 90. How come? It might have something to do with your level of fibrosis. The one thing that I hear most commonly is there a drug out there that could shrink my spleen without lowering my blood count too much? Because a lot of time, by the time your spleen is enlarged, your blood count is already borderline. You're getting close to transfusion dependent. You know, that's a lot of the requests from patient, you know, is there another drug out there where that can take care of me?
So they are doing a lot of development, so that's good, right?
Yes.
In terms of the transplant itself, I do want to cover it a little bit.
Mm-hmm.
How did you feel when you finally, I mean, I know the process was you have to find, so allogeneic, so a donor. What was that whole entire process like?
I pushed for the transplant. When I went in for my first appointment with Stanford transplant doctor was August 17th. After all the discussion, I sat on this patient table and I said, I'm ready, just give me a date.
Well, Kathy's a very intelligent person, and she studied this quite a bit, extensively. And, she's a patient. She has an idea of what she wants. And because it is her health, I usually will defer to what she has to say. I think maybe it's only if I had a very strong opinion in the opposite way that I would speak up. But at the same time, I'd say what I had to say, and then it would be her final decision.
A lot of times they say, hey, you don't need to know about it, just let the doctor take care of you. But you need to be able to make calls on, is this treatment for me? For example, when I was given the initial chemo protocol, it was a part of a clinical trial with T-cell depletion, which doesn't make sense for a full donor match. So I questioned that, and then it was changed to a different protocol. When your fibrosis is high, your bone marrows are not making as much blood. Therefore, your spleen is working extra hard to make up for it. I know some patients' spleens are much bigger than me, and they couldn't find a solution to reduce it. And I feel bad for those patients because their spleen needs to be shrinked enough to get a transplant. And I'm lucky enough, I'm just at the slightly enlarged. Even though 50, some are 24 centimeter, mine was 18. I would say knowledge is power, even though there's a lot of information that's not valid. You just have to figure out which one pertains to you. Also use the knowledge from the group, the Facebook group, because some of these patients did go through the transplant, so they can validate one way or the other. So if you just take it as is or don't even, I'm not saying the doctors not to trust, but I think there's reason they put you in one versus the other. So do your homework, make your own call sometimes. Overall, the experience was a lot smoother than I imagined. I always thought of chemo as something that there's a machinery, but it turned out to be just like a transfusion. I thought I would have reaction to chemo right away, but it's not until 5 or 10 days later, my body started to feel them. One way to describe the initial feeling of chemo was kind of like towards the end of pregnancy. When your body is getting heavier and heavier, it's harder to do basic stuff. Like going to the bathroom takes a lot of energy. Taking a shower requires 2 people's work. Then comes the nausea, diarrhea, but they can be controlled. What I found out later is Zofran works for me. It doesn't work for all the patients. So one of those nurses said, you can have Zofran scheduled every 8 hours, so you never feel nausea. You're ahead of the game. As soon as that happens, my eating was, I was able to eat a lot more than before. So October 1st, starting with fludarabine, 4 days of fludarabine, followed by melphalan. Melphalan, that's the day we need to chew ice. So 45 minutes before, I was getting cups of ice chips from the nurse, chewing like nonstop, all the way through, and plus probably 30 minutes after. No mouth sore at all throughout the process, yeah. And day 0, started to feel tired. Day 1 and day 2, barely ate. But I had like melons and fruits. Then the next few days, my husband pushed me to get up, go walk around, take shower. So I actually did a dance with my IV pole. I like dancing, but he is not into dancing. So I danced with my IV pole because then I can grab the pole with me wherever I want to go. It was really fun because we're playing music. I think it was Tennessee Waltz. I played the music, and when I dance with my husband, he'll fight back, right? Because he has his own mind, but this IV pole has no mind. So that was one of my exercise. I even brought in my 8-pound weight at some point, so I did some weights too, because I know I'm going to lose muscle during those days. And
And you had a great response. I know that GVHD is a big concern for people. And your donor, the donor was your brother, and it turned out he was a really great match.
Yes.
What was that like?
I think age makes a difference. Him being a full match make a total difference. So once I got my diagnosis, the first thing I do around 5 o'clock, he was in China, call him and say, I need you to go get a HLA typing done. I don't want to wait for the doctor to send you the kid. So he did, and the result came back very fast. Looking at the typing, it's so easy to understand. They just look like 12 sets of timestamp. You just compare one against the other. If you match, you match. And it's amazing how, I didn't think he would be a match to me because different blood type, different personality, we like totally different things. So then after that, he was like, okay, let me know when you can get your transplant scheduled. I need to buy the airplane ticket. At the time, China still had some lockdown for COVID. It turned out, interestingly, 2 days before he left, he lives in Shenzhen, across from Hong Kong. That city was locked down. So we were worried he could not leave. And fortunately, right before his departure, it opened up. You can buy a perfect match donor, right? Specially related. It would be nice to win a lottery too, but when you're in that situation, this is definitely better because lottery can't save a life. Well, the first 3 months, I was supposed to be upstairs, hiding away. I didn't completely follow that because I felt okay. I was weak. When I went upstairs, I felt my leg was heavy. So I thought, okay, maybe I can use going up and down the stairs as an exercise to gain strength. And I was hungry all the time. So midnight, I would be eating mini saltine cracker. My husband said I sound like a little mouse in the bedroom. So the first 3 months, every other day going back into Stanford ITA to check my blood. I needed a transfusion a couple of times. After that, I was fine. And see, do I need any adjustment on my medication? They want to make sure because those first 3 months, you could have acute GVHD, your blood count can fluctuate quite a bit.
By the way, do you have to go in still for follow-ups?
Once a month.
Once a month?
Yes.
For how long? And then
probably at least for another year. I did meet another patient, 71-year-old. She was 2 weeks after me in Stanford, and she had some complications, so she ended up having to go back there, actually hospitalized. And I went when eventually one day I met her in ITA. It's like a reunion, and it felt good to see someone who've been through it together. There was actually one patient I met here. He is actually going through a myelofibrosis stem cell transplant right now. I think today is his day 12. Yeah, well, we both, I think I got lucky because my brother is a full match. Asian is actually very hard to find match here. He couldn't find any good match. His 2 sisters flew in from China. They're not good candidate. He ended up using his, I think, 13-year-old daughter, which is a very rare do they use kids. I message him sometimes on, I don't want to message him too much when he is at the bottom right now waiting for his cell to grow. I just hope to hear from him, and that day would be, hey, my white blood cell is 0.01 now. I would say this is one patient, but not just Chinese patient. I message other patients as well, or they message me. I want to share my experience, and I want them to benefit from mine as much as they can.